Alright, starting with the preliminary for SOT, I'm going to have the patient stand and I'm going to be measuring for AP sway greater than 1/4 of an inch. That would be a sign of category 1. Go ahead and turn and face the windows for me. And measuring from the middle greater than 1/4 of an inch lateral sway would be a sign of category 2. And if there was an antalgic lean, that would be category 3. Go ahead and sit down for me. And checking first rib movement. Okay. Go ahead and flex forward and extend back. And movement greater than 1/4 of an inch for one would be category 2. For both of them would be category 1. And if there was no movement at all restricted, it would be category 3. Go ahead and lay down for me. On your back. Alright. And feeling for, if it were bilateral tenderness on L3 laminas, that would be a sign of Cat 1. Left side tenderness on C4. I said L3, I meant C3. C4 left side lamina tenderness would be a sign of category 2. And if there was tenderness on the TVP of any of these that correlated with the opposite for the lumbar spinous process, that'd be category 3. And spinous process tenderness in the cervical with mammillary tenderness in the lumbars for that correlation. So C1 for L5, C2, L4, etc. Tenderness would be a sign of category 3. Next would be compression. So go ahead and lift your legs for me. Compression. And back down. And then including compression, do it again. And was it easier or harder? Easier would be a sign of cervical issue. Harder would be a sign of lumbar. So that means we're going to check for in the cervicals with the stair step. Again. Feeling for clunks, there should be 4 of them that you feel catches. The first is T1, C7, second is C6, C5, etc. And if there was one that was not catching, say it's the third one, you go there and you just do figure 8 motion with the head. Four or 5 times. And then recheck it. It's good. And then going to basic. You start with all fingers along the nuchal line, starting at the EOP, going to the mastoid. Feeling for CSF to pump the same amount in all your fingers. Just feeling for a pulse in all of the fingers to be at the exact same amount. That's good. Basic 3. With your hands, your thumbs in the middle to push them apart, and your fingers on the sides to pull up. You're going to be pulling up and pushing apart as the patient breathes in. And as they exhale, you release. 3 to 4 times with 3 to 4 pounds of pressure. And then we're going to do psoas. Go ahead and extend your arms up for me. All the way. Pulling not on the wrist. And put your fingers together like you're praying. Ooh, that's legit. Go to the shorter side. Go ahead and bring this leg up for me. This might be hard to film. I'm going to have to put my arm underneath your leg, your knee. Is that okay?
It's fine.
Stabilize the hip. And pushing the fingers as the patient inhales and exhale. Push with your fingers down. Inhale, exhale, and push a little further down until you feel the psoas release. And then test. Arm hook for me. and it's better. Alright, for the femoral, just relax, and you push and you want to feel for resistance. See which side is more resistant. Feels like his right side is. That's his left side, just kidding. You go in and you feel greater trochanter up an inch, back an inch, and push on it. And you're going to have the patient turn their foot in, and then I need to be on the other side. Up an inch, back an inch. Turn your foot in, and then as they externally rotate, you're pulling toward yourself. 2 slowly. 1 more slowly. And last one, on the count of 3, you're going to turn out quickly. Turn your foot out. Ready? 1, 2, 3. And pop it. And recheck. Not bad. Good. Last one. Gonna come up here and have you do a muscle test right here. So you're just gonna hold with your hand off of your body. And do this when I pull. It's a good muscle. So you're gonna go on with 4 fingers, do upper quadrant, lower quadrant, same with the other side. Sorry if I'm gonna be near your belly button. I guess you're supposed to find your pubic symphysis for me first. Okay. Awesome. Making sure all 4 fingers are touching in a line. And resist. And then all the way over so you're not overlapping at all. Again, resist. Switch sides. Clear anything if necessary for guys.
Hope that's all video.
And again with the floor right here. Resist. And all the way down again.